Hello everyone. Today in this video we learn about the examination of elbow joint. We will cover it under look, feel, move and measure. Starting with the look, comment on the attitude of the limb, such as in this case bilateral shoulders at equal level with elbow in full extension, forearm in pronation and wrist and fingers in extension. Elbow creases appears to be at same level, however the wrist crease on the affected side is proximal. Also look for the alignment of forearm in relation to the arm, that is the carrying angle. In this case, it should not be commented upon since the elbow is not in full supination. Also comment if there is any scar, sinus or swelling around the elbow joint. Also comment if there is any visible wasting of arm or forearm muscles. There appears to be some wasting of muscles of forearm in this case. On looking from the side, observe the alignment of forearm in relation to arm, such as neutral, flexion or hyperextension. Also look for any scar, sinus or swelling, especially over the inconus triangle. Also look for bony prominences, that is the lateral epicondyle, olecranon and the radial head. In this case, the tip of olecranon was more prominent as compared to the other side. Also, the ulnar border of forearm was concave compared to the normal side, which was convex. From behind, look for the three bony points. Look for any abnormal tenting of the triceps muscle seen in case of neglected elbow dislocation. Again, look for any scar, sinus or swelling, especially in the para-olecranon area where elbow effusion usually starts with. Now the second part of examination, the feel part. The first thing is to look for the local temperature using the back of the hand and compare it from the other side. Feel for any superficial or deep tenderness and start palpating the bony prominences around the elbow. Lateral supracondyle ridge, lateral epicondyle, radial head, proximal ulna and the olecranon tip, middle supracondylar ridge and the middle epicondyle. About the palpation of radial head, with elbow in flexion, palpate the lateral epicondyle. And just below it, there is a fossa where radial head can be palpated and can be confirmed by rotations of the forearm. In this case, the radial head is located slightly anterior and proximal to the lateral epicondyle, suggesting a dislocated radial head. Palpation of proximal ulna revealed a breach in continuity at the junction of proximal 1/3 and middle 1/3 of ulna. Assess the 3-point bony relationship. Inflection, where the 3 points form a triangle, and in extension, where the 3 points come to lie in a straight line. The relationship was normal in this case. Feel for the other soft tissue structures such as the brachial pulse, ulnar nerve and the epitrochlear lymph node. To palpate for the epitrochlear lymph node, keep the elbow in flexion, palm placed at the back of the joint and fingers up the medial epicondyle. Now checking for the movements, flexion extension. To measure, place the fulcrum of gonimeter at the level of lateral epicondyle, the static limb parallel to humerus and the moving limb parallel to radius. Range of motion in this case was from 0 to 80 degrees of flexion, whereas on the other side it was 0 to 150 degrees of flexion. Supination and pronation. Keep elbow in flexion and tuck to the side of the torso. Patient is given a straight rigid object such as a scale or a pen to grasp on either hand. And now to supinate and pronate. To measure, keep the fulcrum of gonimeter at the head of the third metacarpal, static limb parallel to the starting position of the pen and moving limb to the final position of the pen. Now on to the measurements. The arm length. The arm length is taken from the posterior angle of the acromion to the lateral epicondyle, found bilaterally equal in this case. Forearm length. Forearm length is taken from the lateral epicondyle to the radial styloid, found shortened in this case. Measure the bulk of muscles of arm and forearm and compare it from the unaffected side. Wasting of 2 cm in forearm muscle group was found in this case. Measure the base lateral limb, middle limb of the triangle, and compare it from the unaffected side, found equal in this case.
So, on the basis of history and examination, a diagnosis of neglected Monteggia fracture dislocation of non-dominant left side with no distal neurovascular deficit can be made. Here is an AP and lateral radiograph of a skeletally mature patient showing elbow, forearm and wrist with distal humerus and proximal hand. X-ray shows a fracture in mid-diaphysis of ulna with apex pointing laterally. There is disruption of proximal radial joint and radial head is dislocated anteriorly and laterally, thus confirming our diagnosis of Monteggia fracture dislocation.